Thank you for staying with us right here on Good Morning Kenya. My name is Vivian Degwa. Now, every October we get to celebrate Breast Cancer Awareness Month, and it is a month where we just get to spread awareness on breast cancer. Breast cancer is the second leading cause of all cancer deaths in this country. And today on Health Tuesday, we get to talk about breast cancer and get to just know what are some of the early signs of breast cancer, what are some of the risk factors, and how often are you supposed to get checked? How often should you be going for screening of this particular disease? Now, joining me for this particular discussion is Dr. Moses Mwangi, who is a senior pharmacist and leading vaccinologist. Welcome to the program, Dr. Mwangi.
Thank you, Madam Degwa, for having me. Good morning to all the Kenyans.
Yes, we are pleased to have you here on Utamaduni Day. Maybe before we get into this conversation, what are you celebrating about Utamaduni Day today?
Many things.
Yeah.
It's a very special day for me. Special for Kenyans.
Yes.
But it is also special for me. Anyway, being Utamaduni Day is a time when we should think and reflect about other less fortunate people. We can share love as much as we celebrate what we call culture.
Yes.
But I think for me, you know, this day has evolved. It was Moi Day, then it became Huduma Day.
Yeah.
Now it is Utamaduni. But I think for many Kenyans, it's a time to take a short break.
Yeah, to get to rest.
Yes.
But we are here.
Yes.
This is where we are celebrating our Utamaduni Day.
Yes.
Thank you so much for that. Now, if we can get into our topic of discussion today on Health Tuesday, which is breast cancer awareness. But before we get to talk about breast cancer in specific, maybe just what is the definition of cancer and what are some of the common cases of cancer in the country?
Now, cancer is a disease. It's one of the key, what we call lifestyle diseases. You know, it falls into the category of lifestyle diseases that includes diabetes, hypertension, cancer. Now, and it is growing. More and more cases of cancer is being diagnosed. Maybe right now we have more capacity to diagnose than we did before, but also the change in lifestyles, you know, the lifestyle of people, the diets and all that. Cancer is a scenario where the cells, as cells grow and multiply, they have what we call contact inhibition, which means that the cell will grow to a particular size or level, and it knows it has reached. Now, in cancer, the cells lose that contact inhibition so that they grow or they multiply, they become bigger, they become abnormal, and then eventually, generally, you'll have what we call a tumor. A tumor consists of normal cells that have become uncontrollable in terms of development. That's what we call cancer. And of course, by that time, since they are not normal cells, then the body will also react to them as abnormal cells. Here in Kenya, the leading cancers, interestingly, cervical cancer is the #1 cancer most diagnosed in Kenya, followed by breast cancer, and then you have the esophageal cancer, the cancer of the gullet, of the esophagus, then colorectal, prostate, they come together there. Colorectal, that is the cancer of the colon and the rectum, and then prostate, and prostate is also growing as one of the big issues in men, cancer of the men. So, but when we look globally, interestingly, breast cancer is bigger than cervical cancer. In developed world, they have been able somehow to manage
the cervical cancer.
Cervical cancer, because there is something you can do. There's a vaccine, and there are some, if it's detected early, so especially vaccines and screening. But here in Kenya, unfortunately, cervical cancer is still a big deal.
But still on that, why is it a big deal and there's a vaccination to it? Is it that we don't have enough resources?
In fact, human papilloma virus, which is a vaccine, HPV, is even available in the public sector. But for some reason, people are not going for it. Girls at the age of 9, before they become sexually active, should receive a HPV vaccine. It's a 2-dose regimen, but it can be given to any woman between the age of 9 years all the way to 26, even more. But the idea is to give this vaccine before someone becomes sexually active, because it's a sexually transmitted disease. That way, we can prevent it. And for me, from where I sit, I think we need to create more awareness. We need to have more awareness. Now that we have these community health volunteers which have been sent, I hope they can be trained so that they train our women. You have a young girl, age of 9, 10, we should give them the vaccine so that in future they don't have to suffer from cervical cancer. That's what the developed nations have done. This vaccine has been available for more than 20 years. Even more. So its safety is very well known. Its efficacy is very well known. I think it's just awareness and to remove the myths, because sometimes there are people who throw in myths there. This vaccine is very safe. Yeah. Okay.
Maybe what are some of the lifestyle vices that we have as a people that may lead to the increase in the cause of cancer in the country?
Now, what is happening in terms of development, as we become more and more developed, then we acquire lifestyle. For example, we make lifestyle choices. For example, food. Food is a major issue. In our traditional African setting, our food was pure from the shamba. You eat it, and it's grains with a lot of fiber. It's sweet potato, very healthy. Now, as we become urbanized, you see people's taste buds changing. So we find now we have fried food. You have, for example, chips which are being fried by oil, which is being repeated. And you see this is what, anytime you put a fast food restaurant, even in our rural settings, that becomes a place. And yet this kind of diet then become a problem. Then we have, of course, things like processed foods. Processed foods, especially meats that are processed and therefore preserved. They have some preservative, the likes of sausages and other kind of things. Then those processed, smoked, especially smoked meat becomes one of the modernity, and that comes with it. And then when you talk about processed food, for example, ugali, we find people preferring, flour that has been removed, husks, pure starch. The major elements are removed. Whole grain maize, because we are lovers of ugali, whole grain maize meal should be your choice. But again, so all these kind of changes. And then people have become more sedentary, lack of exercise. More and more, even in offices, people are sitting behind computers and just sitting. More and more, you find even in the villages, thank you to the boda. People are not even walking. You'll find somebody else for a boda right from the house instead of walking to the stage. So we have become more sedentary. So exercise is a very major issue. Physical exercise is very important. So when people just sit, if I go a little bit to the human evolution. There's a person who was called Homo erectus, and the person who stood and walked.
Yeah.
Now we have become Homo sitters. We just sit.
Yeah.
So these kind of things are bringing about what we call lifestyle diseases, cancer being one of them.
Okay.
Yeah.
Okay.
And then people are also growing older because, for example, even breast cancer, age is a factor.
Yes.
The older you are, it's a risk
more
factor.
prone.
So we have more people are growing much older. Therefore, we are diagnosing more and more lifestyle diseases.
Okay. Now, if we can get into what are some of the early signs of breast cancer?
First of all, to say that breast cancer can affect women and men. Breast factor, 99% of breast factor is in women, but men also can suffer from breast cancer. 1% of breast cancer cases is in men. Very important. But women are more prone. Then the other risk factor is age. And then you have issues which also affect other lifestyle diseases, obesity. And more people are, we are consuming too much starch, and especially people from the mountain.
Yeah.
You see, like breast cancer, the leading counties will be, Nairobi, Kiambu, Nakuru, the mountain. Yeah, people are eating too much starch.
So too much starch is a risk?
Yes, it's a risk because too much starch means what? Weight. When you have excess weight. In fact, obesity itself is a big risk factor, not only for cancer, but for diabetes, for hypertension. So generally, that's a big issue. So obesity, what food you are eating. Then when it comes to breast, I think those are the things. There is a small percentage of people who have a certain cells in their breasts. It's called BRCA1, BRCA2. That's genetic. It's a small percentage, but if your mother or your grandmother or your great-grandmother had breast cancer, more than likely there could be a girl or a woman in that family who might suffer. And if we check, we may find there is this genetic factor, BRCA1, BRCA2. However, it's a very small factor. Majority of breast cancer cases, they can affect anyone. Yeah.
Okay, I'll take you back to the early signs of breast cancer. But before we get there, there's something you've mentioned. Someone could be at a much higher risk of getting breast cancer if they have a long family history of breast cancer. Maybe to someone who's watching us right now and they know that maybe their grandmother, had breast cancer, their mother has breast cancer. What preventative measure do you take to someone who is more prone to breast cancer like that? Okay.
Now, it's a predisposing factor. Now, if you know you have that predisposing factor, it doesn't mean that you spend all your life worrying. It means that you make some lifestyle choices.
Yeah.
For example, in order to detect the early symptoms before they develop, there is what we call self-breast examination.
Yes.
Every woman should regularly check their breast. I advise that when you go to the bathroom, you're taking a shower. It's a good moment for you to explore your breast and just check whether there is any lump. We call that self-breast examination. In case you feel something unusual, you can check your teeth to see whether they are removing anything untoward.
Yeah.
Then that if you have there is that long history, then your awareness for self-breast examination from as early as possible becomes an important matter. The other one is to choose healthy lifestyle. What do I mean by a healthy lifestyle? Choose the food you eat. We should be eating more vegetables and fruit and balanced diet. Generally, be conscious about your weight. so that you choose healthy lifestyle. You should be concerned about your exercise. You should be doing more exercise. You should avoid living very sedentary life. That way, you give yourself a chance. But having said that, as we said, you know, there are some people who come from that kind of history, who get checked for BRCA1 and BRCA2, whether they have the cell. And some of them would choose. I think there is a famous woman who chose to have all her breasts removed.
Yeah, I saw that as
it's not advisable, really, but you are taking precaution. If you have those cells, then you just become more conscious. Seek medical attention as quickly as possible. When you hit 35, 40, have more regular, on top of self-breast examination, have more regular what I can call clinical breast examination. We used to recommend you could do mammography, but again, we also have to be careful because of radiation. We don't want to overexpose radiation. That's what you do.
Okay.
Yeah.
The early signs. So you can feel a lump.
Yes, the early signs.
Change in color.
Exactly. The early signs, as I said, you need to do regular self-breast examination. If you feel some lump that is not normal and you are concerned about it, if you press your teeth and there is some bloodish substance coming out, some bloody substance that is unusual, you should check your breast if it changes in texture, if it changes in size. You know, you should be aware of yourself. Then those are early signs that would trigger you to seek help.
Okay.
Yeah.
And are all lumps cancerous?
No, not all lumps are cancerous. In fact, majority of lumps are not cancerous. When you check and you find there is a lump, you can also check the lymph nodes towards the
armpits.
The armpit. So in the early stages, it may not even be painful. You may not even feel. But when you find some lumps that are unusual, that are persisting,
how are you able to differentiate? This lump could be cancerous, and this is just a lump that is non-cancerous. Is there a way to differentiate by yourself?
No,
at home?
You may not be able to differentiate. That's why if you feel that there's an unusual lump, you know, the texture of your breast is not feeling what you normally feel, you need to seek medical attention. When you go to the hospital or clinic, the nurse will also now do a clinical examination on your breast. Then the doctor will do it. If the doctor feels that I want to confirm, then they can take mammography to check. And then if the lump in a mammograph is looking, we are concerned about it, then they can go ahead and take a sample for checking in the laboratory to check whether it is benign. Benign means that it's not malignant, it's not cancerous, or it is just you know, a lump that has occurred. Then the doctor will decide. So your job is to check. If you find a lump, if you find something coming from your teeth, the next thing is seek
medical attention. All right, and when we go to the doctor, you've mentioned mammography as one of the tests to confirm a diagnosis. What are some other tests? Because you've mentioned that it's not as safe because of the radiography, radiation rather.
Well, you know, you have to weigh. You'll do mammography. There's a time we were saying you can do them every so often. If the doctor finds that the lump is concerning, or the texture of the breast is concerning, then they'll go ahead and ask for a mammography. And then at that point, the next level will be to take a tissue, take a sample, an aspirate, and send it to the laboratory for analysis. Remember, the breast has several tissues. There are ducts, and then there is the breast tissue. So the doctor will check, and they can actually, if it's a doctor, a clinician, they may wish to refer the case to an oncologist. An oncologist is a physician who has the relevant training on cancer diagnosis and management.
Okay.
Yeah.
Now that you've brought that up, do we have enough cancer specialists in the country?
Do we have enough doctors even in the country?
That's the question.
And even the few we have, some of them are at home, not employed. Others are leaving the country. We have very few oncologists, very few, a handful. In fact, many so-called level 5 hospitals don't even have a single oncologist. So we have few in the country. We need to train more. But if you ask me, one of the biggest issues we have in Kenya is that breast cancer and most cancers are diagnosed fairly late. Cancer is also breast cancer, and other cancers are classified. We have stage 1, stage 0, stage 1, up to stage 4. If you catch the breast cancer between stage 0 and stage 3, you can actually treat it, you know, and reverse it completely. But majority of cases come late. So if we had a proper working healthcare system, we need some doctors at the front line, right at the primary healthcare level. We don't have enough, but we have enough there, where cases can be identified earlier by a medical doctor, by community health, by a clinical officer or a nurse, and there is a doctor to refer to quite there, and then the referral system can work faster. Then if we identify it early, we will be able to deal not only with breast cancer but all cancers. But unfortunately, most of these come early. That is why you as an individual, you have a part to play if you are able to examine yourself. So very few doctors, very few cancer treatment centers in Kenya, very little money allocated. In fact, unfortunately, most of the people, once you are diagnosed with cancer, breast cancer or whatever cancer, you find yourself on your own. You know, if you have had a pre-existing breast cancer or a cancer, even the insurance company doesn't cover you. So it's in terms of cancer, is a very it's a disease that is really very expensive to manage, and therefore awareness, and that is why we have an awareness, is a very important matter, because you can be your best doctor. Yes.
Yeah. Aside from self-checking or self-examining oneself in the house, I think what we're really pushing is for people to go out there for screening, because there are some you might not be able to spot, you know, whether you have all these early symptoms that you've just mentioned, because in non-invasive cancer, you might not be able to notice, right? So how often should one go for screening?
Now, you see, that should be the dogma, and that is why the West, or where you have properly working healthcare system, that screenning, which we would recommend by, you know, because this is also an age-related disease. When all the way from the age of 30, you can begin to check. Screening in hospital from the age of 40, we need to do it every 1 to 3 years.
I'll have to cut you short. We'll get back with that. Right now, we take a very short break. Don't you go too far. We'll be back with this conversation. Welcome back and thank you so much for joining us right here on Good Morning Kenya. And today on Health Tuesday, our topic of discussion is breast cancer awareness. And it's a conversation that we had already begun. And just before we took the break, Doc, you were telling me about how often one should go for screening. And maybe also with that, you can just tell us the importance of early detection.
Let me start by the importance of early detection. Because breast cancer, like other cancers, you have from stage 0, stage 4.
Yes.
In cancer, we say, catch it early, cut it out. If you catch it early, before it has spread, in stage 0, you may not even be able to see it. It's just right there in the primary place. Then stage 1, you can detect it. The tumor may be between maybe about 2 millimeters or thereabout. And then stage 3, stage 2, it is beginning to grow and to spread. And by the time you are in stage 4, it has spread to other organs.
Yes.
Now, when it has spread to other organs, it's much more difficult to deal with. So catch it early, cut it out. So early detection. If you detect it early, we are likely, in fact, breast cancer is treatable. We are likely to be able to treat it, whether through surgical procedure or through surgical augmented by chemotherapy and radiotherapy. Now, the private sector in Kenya, the medical health care private sector in Kenya, at least they offer, in quite a number of hospitals, we offer free screening for the breast. Yeah. They will do the clinical examination. If you need either an ultrasound, breast ultrasound, or a mammogram, of course that you pay for. And this is what we'd like to encourage, even in our public health systems, public health hospitals. We need to provide clinics where women can be screened, because individually you may not be able, and if you detect something, it's best you are checked. But you go to majority of our public health hospitals and these services may not be available. As we do this awareness month, we would like to really urge that our healthcare people, right at the level 3, level 4 hospitals, to have these facilities available so that women who feel something, or even if you don't feel something and you are especially over the age of 50, it would be in your interest to check your to have yourself checked between 1 to 5 years, at least once. If it's possible to actually just be screened on an annual basis after the age of 50, it would be advisable. For the younger women from the age of 30 above, self-examination, if you feel something, go and check. We don't want to completely be doing mammographs at that age, except where indicated, except where it is indicated. Then you'll be able to, you'd want to do that. Yeah.
Okay. Since age is one of the risk factors, and you say the older you get, the more at risk you are to getting breast cancer, does this mean that there are no breast cancer cases of maybe people under the age of 18? Are they there?
It's very rare at 18. Of course, as our lifestyles are changing, now we are also catching diseases at a much earlier age. Okay. But even, remember, as women, as you pass through puberty, there are all the hormonal changes that are taking place. So as early as a teenager, it's also good to check. Sometimes we have, they are rare, but we have seen some cases below the age of 18, but they are rare. Largely, it's a disease. It's something that we see, breast cancers, we see it above the age of 40, more above the age of 50 as you grow older.
Okay.
Yeah, but the earlier you start checking yourself, the better.
The better.
Yes.
Okay. While we were beginning the show, I remember you mentioned that there's a fraction of men who get diagnosed with breast cancer. Maybe this is not something that is talked about as much. Is there a stigma around that?
Now, first of all, if you take the number of cancers that in Kenya we have maybe over 6,000 diagnosed breast cancers every year. Out of that, 99% would be women, 1% would be men. So, in a sense, it's more found in women than in men, but it is there. And when, you know, for men, in fact, men how many men examine your breasts regularly? Very few.
Yeah.
Of course, men also have their problem of prostate cancer, but it is there. When a man has breast cancer, and I know a few, they really don't want to talk about it. People don't associate men with breasts, even though men have breasts.
We all do.
But people don't associate breast. When you talk about breasts, you think women.
Yeah.
But then the man, those who get breast cancer, and it can be quite severe, you know, and because it's not something that the men are conscious about, many times it's diagnosed late. Therefore, there's some stigma, as you might imagine. You know, if a man has breast cancer, is he a man? You know, yes, men have breasts.
Yeah.
In the same way that women can get breast cancer, men can. So men, you should also be concerned and aware. And also, men are also living with women. They are living with their wives. You know, you can also help in examining the breast.
Yes, you can do that back at home. Well, I want us to get back into the treatment options.
Yes.
And you had mentioned it will depend on the stage of this particular cancer. But I would want to know just how affordable is it? Because we know that, I mean, for many households, you are just one cancer case away from poverty. So just how affordable are the treatment options in this country?
Let's just say, as we say, catch it early, cut it out. If you catch it at between stage 0 and stage 3, then you are looking at surgery.
Yeah.
And that surgery can range from removing a lumpectomy, to removing the lymph nodes, the lymph nodes, if it's spread a little bit more, to removing a part of the breast, partial mastectomy, to removing the whole breast, mastectomy, and in some cases removing both breasts. And as you remove, it can also range to, as you remove, you can also do some preservation, because breasts are also very important for lifestyle. Yeah. So you can remove your breast. Sometimes the surgery can also remove, and you also do some preservation, so you can enlarge the breast, the remaining. So that's surgical operations. If the disease has spread beyond stage 3, then you may need to maybe first of all give some chemotherapy to reduce the size of the cancer, and then maybe you may be able to remove it through surgically, or and in that case, removal of the breast can also require radiotherapy as part of the therapy. If we are in stage 4, the only option we have is chemotherapy and radiotherapy.
Yeah.
How affordable is this? It's not affordable for majority of Kenyans, but what option do you have when you have breast cancer or you have any cancer? What option do you have other than to manage it? You just have to do it. And that is why people will sell their cows, they will sell their shabas. It's a really, when it comes to healthcare financing in our country, we are doing very badly. And so majority of people will find it difficult. Fortunately, I think the NHIF is currently covering some of the screening costs, which I think is a clever thing to do, because if you can help women to screen, you'll be saving medical costs somewhere along the way. So I think health insurance companies like NHIF and others should support women to do screening. And I think we need to have a cancer fund in this country. We need to find a way of supporting people who have cancer. It's one of the issues that as a country we are not doing well, because people are left poor. They sell their cows, they sell their land, and because most of these cases come late, eventually, of course, the doctors will work to prolong life and to improve the quality of life, but sometimes families are left impoverished. In this Cancer Awareness Month, I think as a nation, we need to reflect, because these diseases are increasing. In my view, we need to have a fund that can help people access care. Otherwise, when we are left on our own, people suffer and eventually don't get the best care.
Okay, as we get to finish with this conversation, most people look at cancer generally, not just breast cancer, as a death sentence. So would you say, as a doctor right here, would you say that cancer is curable?
Cancer is curable. In fact, most cancers are curable. Breast cancer is curable if you catch it at stage 0, stage 1, 2, and 3, and if you get the right care. It is curable. If you've been diagnosed with breast cancer, it's not a death sentence. Of course, it will also lead to, the management. There is the medical management, and there is also some lifestyle adjustment that people need to make so that you don't feed the cancer. You know, the cancer cells like to eat sugar, a lot of sugar. You know, they like to eat a lot of sugar. So if you are managing cancer, you want to minimize the amount of sugar you are taking. There are a lot of dietary choices that you have to make. Some of our traditional dishes, like the potato, the sweet potato, and others which are good. It's not a cure, but it helps you. So cancer is not a death sentence. Even I started at the beginning by saying, look, cervical cancer should not be a problem in the future. There's a vaccine available. We don't know what is the real cause of breast cancer. The solution will be to find a vaccine. But for you to find a vaccine, you need to know the cause. We don't know the major cause of breast cancer. And one day when we get to know, then we make a vaccine. Now there's a vaccine against cervical cancer. Why are we not giving our girls cervical cancer? Really. So cervical cancer, we have a solution. We have even other cancers. For example, the cancer of the liver, 80% of the cause of the cancer of the liver, hepatocellular carcinoma, is a virus called hepatitis B. There's a vaccine which we have been giving our kids since 2001. So we hope that hepatitis B carcinoma of the liver is addressed. So all I can say is that if you're diagnosed with cancer, it's not the end of the world. What you need is to go and see your doctor, is to follow your doctor's instructions. But I also address my colleagues in the healthcare professional. If you find it's a cancer and you are not properly qualified, please refer early. The earlier you refer, there is no need of keeping on giving symptomatic treatment. Many times the patients are getting symptomatic treatment of this or that. By the time they are coming to see the oncologist, it's late. So let's refer early.
Okay.
Yeah.
Okay. Thank you so much, Dr. Mwangi, for joining us on this particular conversation. And I believe that we have gotten to take home a thing or two. My take home is that we should check on our lifestyle. And number 2, let's do the self-checking and let's go out and get screened for breast cancer. This is where we call it a wrap right here on Good Morning Kenya. And as I leave you, I want to leave you with a feature on Utamaduni Day. My name is Vivian Dagwa. I'll see you tomorrow. Enjoy the rest of your viewing.